Please help yourself to some snacks and grab a seat. And welcome to our briefing on H.R. 1 and states' response to all the different provisions in the bill. It's really good to see so many people in the room. We have an excellent panel, followed by an equally excellent panel that's focused on SNAP. The first panel will more broadly discuss some of the state responses to H.R. 1. I wanted to just take a quick second. I'm sure most of you in the room know that H.R. 1 was signed into law back in July, and it has significant policy and budget changes in it, including large cuts to both SNAP and Medicaid. And I wanted to share a little bit of our analysis with you on that front to just set some context. So you have at your table our baby's budget and our children's budget books. And you can look at the overview chapters and you'll see that the share of spending on children has been declining for 4 straight years. And it's hovering around 8.5%. The share of federal spending on babies and toddlers, so children under age 3, is even lower than that. It's just below 1.6%. So here's something, I think it's on page 17. If you take a look at the bar graph there, you can see that Medicaid and SNAP spending on babies together, those two programs comprise about 47% of the federal funding going to our youngest children. I want that to sink in a little bit. That's almost half of what we spend on babies and toddlers are the two programs with the biggest cuts under H.R. 1. So I am delighted today to introduce the first panel to talk about some of those issues. How are states viewing H.R. 1? What are they planning? What actions are they already taking? Some of the requirements have already kicked in. There's more happening later this year and again next year. So there's lots to talk about. And the impacts will not just be programmatically, but also have budget consequences for the states. And the states, unlike the federal government, have different balanced budget requirements than we do. So I'm delighted to introduce our panelists and get the discussion going. And if you have questions, please feel free to raise your hand and join in. I hope that this becomes a discussion because there are just huge implications for kids. Every aspect of their lives will be impacted, from their health, education, nutrition, and economic well-being. So again, thank you, and I thank my panelists for traveling and joining us here, and fingers crossed that everybody gets on their flights and gets home safely before we get a huge ton of snow. So first, to my immediate left is Whitney Jemison. She is the Director of State Fiscal Policy Research at the Center on Budget and Policy Priorities. Welcome. And next to her is A.J. Griffin. She is the CEO at the Potts Family Foundation from Oklahoma and a former state senator. And next to her is Gabrielle Ubaez. I hope I got that correctly.
You did.
And she comes from New Mexico. She is the executive director of New Mexico's Voices for Children. And then at the end, we have Tremel Howard, and he is the state director for Ed Trust in Louisiana. So welcome. So Whitney, I'm going to start with you, and I'm also going to sit down.
Sure.
Please. So you are working on, at the center, you are working on a national program where you're tracking some of the trends and how states are responding and what the impacts might be on their health systems, their budgets, and more. Could you start by talking, what are some of the challenges and the concerns that you're seeing across the nation? And then I would pose that question to your fellow panelists to talk specifically about what some of those challenges are in each of their states.
For sure. So can everybody hear me all right? We're good? All right. So I would say that the first challenge that is true across every state context is exactly the one that you already mentioned, which is that states have to balance their budgets, right? Because states can't run a deficit or raise new revenue without approval by their lawmakers, And because HR 1 shifted such huge new costs onto states, they are now scrambling to figure out how to make their budgets work without the federal funding that they were previously planning to have, right? And that is happening across every state, but on completely different timelines. So I guess a second but related challenge is that all the states run on their own legislative timeline, right? Which means that in some states, they have as little as 30 days to pass their state budget, to figure out these things, to make these decisions, and if it's going to be hard trade-offs that are forced because of these new costs that came down from the federal government, in some cases, that's going to mean 30 days to not only decide what to cut or to decide to raise new revenues, but to reach some kind of consensus on it, which is an incredibly difficult hurdle to get over, right? I mean, just one example, Washington State has a projected $2.3 billion budget shortfall right now and a 60-day legislative session this year because it is an even-numbered year. Right? And several other states have even shorter sessions this year, which is likely then going to result in the need for special sessions later on in the year to try and figure out anything that they can't about their budgets within these short timeframes. So that's a big challenge. And then I would also say just the massive new costs. That is the second challenge that all the states are grappling with immediately right now. There are some direct costs, right? HR 1 included a requirement that states set up these new administrative hurdles in health and food programs that will take time and training within their state offices. But also, there's an unprecedented new requirement for states to share for the first time ever the food benefit costs associated with the SNAP program, which, again, they weren't planning to do, right? So now states have to figure out where that money is going to come from and either raise it through, new taxes or cut it from existing programs or from the populations that were already benefiting from, SNAP and Medicaid in those states already. So that's a problem. And I would say that there are also just more indirect costs that states are already thinking about. So there are conformity interactions between state budgets and their tax codes and the federal tax code. And the new federal tax cuts in some states would automatically apply in that state as well unless they take an action to decouple. And so we've already seen states starting last year start to make moves to decouple from the provisions in HR 1 that would be most expensive for them. So lots of states have already done this. There are, options with that, but then there are also lots of indirect costs that are coming from the new strict limits on provider taxes that help finance Medicaid. So an example on here, Minnesota has done a lot of studies. A lot of states have taken that first step to just do a budget study, right? And in Minnesota, they found that the increase in administrative costs for Medicaid work requirements is going to add roughly $160 million in annual local and tribal expenses, $5 million in additional state-level administrative costs, and then it would lead to a $200 million reduction in federal program funding over the lifetime of the program. So additional long-term spillover costs from cuts to affordable health care are also going to impact every state, right? People don't have health care anymore. They are going to now be seeking uncompensated care. It's not like things are going to stop happening to people. They're just going to stop going to the doctor early, and then they're going to go into emergency rooms and try to get that care, and they won't have money to pay for it anymore. So we're also likely to see a lot of rural hospital closures especially, right? I mean, there are just lots of compounding effects, and states are just now getting to the point where their studies are in that they were doing toward the end of 2025 about what's going to happen, and they are starting to try and have these debates about what gets in the budget and what doesn't.
And before we move on to you, AJ, are states considering or moving to raise revenue? I mean, you mentioned the decoupling thing, which I think is important, and they have to legislate that, correct?
Yes.
And what about revenue options?
So yeah, I mean, it is on the table in some states. I would say that the larger kind of umbrella of what they're looking at right now is protecting revenues they already had through things like conformity. And a lot more states have moved on that quickly. Delaware, Maine, Pennsylvania, DC, they have all already decoupled from really expensive provisions. But there is conversation about how to raise new revenues. I will lift up, for example, just Montana. Their legislative fiscal division estimated that the state's going to lose $114 million in revenue just from income tax adjustments that are in HR 1. And so now in a state like Montana, where that is not always especially popular, there are lawmakers who are reaching out and saying, what sort of options do we have to raise new revenues here that could potentially get some sort of consensus in our legislature, because we have to do something, right? Because the alternative is to cut services and to kick people off of these programs, right? And a lot of people, and especially children, really depend on them, to your earlier point. But there is also options. Like, we are not seeing a lot of states yet actually come forward with a lot of new revenue raisers, but they are asking about some of the examples we've seen in other states, right? Massachusetts, not too long ago, 2022, passed a millionaire's tax that is doing really well there. It has outpaced expectations since passage by $3 billion. Right? So it has brought in a total of $5.7 billion in additional revenue since 2022. Right? So it's an option. They have used that money to invest in universal school meals, free community college, fare-free regional transit, all sorts of things, right? And so lawmakers are getting ideas from that, but we'll see what happens. A lot of states just started their legislative sessions this month, so we'll see what other ones kind of rise to the top. But then the last bucket, I would say, is just reclaiming state revenues, too. States have made a lot of choices in the past 5 years, especially since the pandemic, that really put themselves in a bad position with their budgets, using a lot of the one-time federal aid money for ongoing needs, or hoarding it in rainy day funds rather than using it for all of the various needs that people came to their legislatures with. And what has happened over time is that those revenues have started to come back down to a more regular level, right? We're not seeing the sort of revenue levels in states we were during the pandemic. That federal aid is expiring. And then during that same time, states were passing permanent tax cuts because they were arguing that they had all of this money that was one-time money, right? And so all the state level tax cutting, a lot of it was triggered the same way that a lot of the provisions of H.R. 1 are triggered to come into effect over time. But 2026 is the year when a lot of states' tax cuts are really coming home to roost. So they are in a really difficult position, and now there are new calls to reject previously approved cuts and to just turn them back, or even to pause them, just to give states some time to figure out what to do. Hawaii's governor has actually come out really early and already asked that a huge package of tax cuts that they just recently passed, that they pause them for the next 3 years until the state can figure out how to plug its budget holes because of the effects of H.R. 1. I think we're likely to see more states taking that approach.
Take a pause on the. Yeah, thank you for that. That's a lot of important information. AJ, share with us the story from Oklahoma. What
I
did you
feel
hear?
called out on tax cuts.
It's bad news.
To set the stage and put everything in perspective, of course, it's a fairly small state, a population of about 4 million. Our entire state budget from all sources is roughly the same size as the University of Texas budget. So perspective and scale is very important. Our legislative session starts the 2nd of February and will end the last Friday of May. So they'll have 4 months, slightly longer than some states, to make this adjustment. Our Appropriations Committee chairs say that we're right now seeing a budget impact of $739 million. That is very significant because last session, we saw an elimination of the tax on groceries in our state. Sounds like a great policy. Saves the average Oklahoma family $200 a year and was a $310 million hit to the state budget. So there's about half of it right there. We also reduced our income tax another 0.25%, which is another $350 million. At the same time, have done some of the hoarding that you mentioned. The coffers are full. In my conversations with our state leaders in the appropriations, there's really no intention of using much of that money to fill this hole. However, we have a couple of positives. Probably the biggest one is several years ago, we established a fund to deal with changes in FMAP on Medicaid. A 1% change in the FMAP reimbursement rate for our state's about $60 million. This fund was to set aside to make adjustments when that occurred based on the economy in the state. And there's about almost $500 million sitting in that fund. So one of the steps I think, I hope they will consider, and it was one of my suggestions, is to take that fund and loosen the rules in order to make immediate accommodations to Medicaid. Half of the children in our state are covered by our Medicaid program, half. And in a state where rural healthcare is already in dire straits. We have 77 counties, and of those 77 counties, maternity care is only available in 21. Any care of any type. Further destabilization of the rural healthcare system just simply isn't going to be tolerable for us at all. I tried really hard, and I'm like, okay, I'm a private funder. I'm no longer dealing with the state funds. I'm going to find something good. So I did. There are some changes in HR 1, one that is actually a positive. There was an increase in the standard deduction, right? But individuals using the standard deduction can write off some donations. That's great. The problem is, at the same time, we saw some hits, floor on corporate contributions, and the National Center for Nonprofits estimates that in the next 10 years, it's about a $40 billion hit to philanthropy across the country. So at the same time, when we expect you guys, you think you got problems? Hold my beer. When we expect the nonprofit, and the exact words from legislative leaders are, now is the time for the nonprofit community to step up. Food insecurity is the #1 issue anywhere in the state. Trust me, they're stepping up. But at the same time, we anticipate seeing further erosion of the nonprofit's capacity to fill that gap. At the same time, we're seeing reductions in state. My biggest problem with the SNAP error, we are a high SNAP error rate, almost 11%, 10.87 of that. About 20% of it is underpayments. What constitutes an error? What does that mean? The average SNAP payment for a family in Oklahoma is $260 a month. If you miss it by $5, is that an error? So we really need to know more about how to properly implement that, because I anticipate if allowed enough time, AI technology will make that much, much easier to narrow that gap. And as a taxpayer, we all want the error rate to be 0. That's going to require an investment in technology. You mentioned the work requirement. About $5.2 million is the oversight cost for that in Oklahoma. So it's not good.
So maybe a delay in the SNAP cost sharing might be helpful?
Yes, significantly. Well, and access to the technology necessary to properly implement it would be, or at least what does proper implementation actually look like? What is our goal? And is that goal reasonable and created with the input of the states that are actually having to implement the program?
Yeah.
And, go ahead. Whitney.
Oh, I was just going to say, I didn't mention it, but since you bring it up, there have already been a few states who filed bills seeking to make different technological updates so that they can streamline eligibility reviews and try and get their SNAP error rates down, especially. But I think that the problem that we see with even that approach right now is that the states don't have the money for the updates and also to backfill the holes in the programs themselves, right? So like Louisiana, Missouri, Virginia have all been looking into this and doing some work on that tech update side, but like the amount of time that it's going to take to get that up and running and working well for people, and also the absence of more federal guidance on, what it should look like, I think is really holding them back right now.
And AJ, I mentioned this before we started, but it would be great if the Medicaid and SNAP systems could somehow function together in some way, but it's probably not likely.
We actually have had legislation filed and a lot of ideas around a universal application system. There are people that are working on it. The challenge lies in that these are systems and program qualifications that aren't aligned. And so it becomes really untenable, and states wind up having to try to design something internally, and the cost of creating that software is just so significant. And then it's a moving target very frequently.
Yeah.
Trying to hit that moving target becomes a challenge.
Yeah.
I will say, too, when you mentioned revenue raisers, the last time, in 2017, we did have a budget hole of approximately the same amount, which was backfilled by an increase on gross production tax and tobacco tax. Neither of those are even possibilities with the current political environment in the state.
Thank you for that. Lots to think about. Gabrielle, what are you hearing and working on in New Mexico?
Thank you. So, in all the doom and gloom, I don't want you to be jealous of New Mexico. I want us to give you hope. So the thing that we're really famous for right now is our governor announced universal child care for the state of New Mexico, regardless of income, in November. So that is a really exciting thing in New Mexico. At New Mexico Voices for Children, what we work on is finding where our revenues, our policies, and our budget align so that children and their families can live a life of dignity. I think we've been really lucky, and I want to talk a little bit, even though we're a 501c3, so we don't do electoral work, just share a little bit about the conditions that made this moment possible in New Mexico. And so right now, we have quite a progressive Democratic majority in both our state House and Senate. We also have quite a progressive governor. In some instances, she's very tough on crime right now, but everything else, she's bold in her vision for what it means to serve children and families in our state. And that was a lot of work on the ground over the last, I would say, decade of organizers doing the work to get the right people in office. So as an example, our Speaker of the House, Javier Martinez, comes from an organizing background. He used to run an organization called Partnership for Community Action that was supporting home child care providers and creating like cooperatives and small businesses. And so he comes from the grassroots of believing in universal child care as a right. Same with our governor. She saw childcare and early childhood education as part of what she was going to change in New Mexico. At the same time, we're a state that has, for many, many years, regardless of party, been ranked 50th in childhood well-being. We are the organization that holds the Kids Count report. And so we're both at a moment where we're starting to finally move the needle with bold policy while also being the state that is most dependent on federal aid. So when H.R. 1 was signed, there was a big article in the New York Times, and New Mexico was the state featured because a third of our state budget is federal dollars, and we have many families who depend on SNAP for food and Medicaid for health care. We've been really lucky because of the conditions being what they are in New Mexico. We had 2 special sessions between H.R. 1 signing and our legislative session, which just opened on Tuesday. And so during those 2 sessions in October, our legislature and our governor, in one day, we didn't have to advocate much. I shouldn't say that, but I will say we do educate them throughout the year, and we have the right people in office right now. They very quickly came into alignment to cover the gaps that were happening in Medicaid. We also had money set aside in a healthcare authority fund that hadn't been tapped, and so they used that to cover Medicaid gaps in the meantime. We also had a second special session in November when the federal shutdown happened to make sure that people could continue having access to their SNAP benefits. So all that to say that this didn't happen overnight. It was a lot of work on the ground, making sure we had the right people in office to make this moment possible. The other thing that I'll add for context is New Mexico is the second wealthiest state in the nation, which is a surprise to many people. We have the second largest sovereign wealth fund. We have many permanent funds. 15 years ago, we had $14 billion in savings, and it's grown to $60 billion. And that's because we're an oil and gas state. And so a lot of these permanent funds are funded through royalties in oil and gas. And our state investment council has been really smart and thorough about where they're putting that money so it can generate revenue so that we're not so reliant on volatile oil and gas revenues. Do you need me to stop? Do you need me to stop?
Pause.
Yeah.
Yes, all right. All right, we are going to take a quick pause. There are votes going on this morning, so as my former boss, Barbara Mikulski, would say, the schedule is a little rock and roll. No better way to keep the schedule rolling today than for me to introduce the ranking member of the House Agriculture Committee, Angie Craig. It's an honor to introduce a first focus on Children Champion for Children awardee and a member of Congress who understands that food policy is not abstract. It's about whether children have food on the table, farmers can stay afloat, and communities can thrive. I'm Chad Bolt, by the way, Senior Vice President for Economic Security at First Focus on Children, and later today I'll be moderating a panel all about the SNAP state cost shift. So really, there's no better person for us to hear from about this. The chaos of the shutdown marked perhaps the most turbulent period ever for the program, with even more uncertainty looming on the horizon, and Congresswoman Craig has been fighting to defend SNAP every step of the way. She understands that SNAP is not just a safety net for families during hard times, it's a stabilizer for local economies, a lifeline for rural communities, and helps make groceries more affordable at a time when families are getting squeezed. The Minnesota 2nd Congressional District is so fortunate to have her as their representative in Congress, but we are all so fortunate to have her leadership on the committee and to have her here with us today. So it's my honor to introduce Congresswoman Angie Craig.
Whoa, you're tall. Let's get you down a little bit. Well, it's an honor. I'm sorry to the panelists to interrupt you here, but we're in the minority. I'm not in charge of the vote schedule, so unfortunately. Good morning, and thank you so much for having me here to speak to you today. I'm Angie Craig, and I serve as the top Democrat on the House Committee on Agriculture. The way you get that job is the 214 Democratic members of Congress elect, it's another election you have to go through, who they want to lead the committee. And so it is such an honor to have been selected by my colleagues across the caucus to lead this committee. I'm here today, and I know all of you are here today to talk about the effect of H.R. 1 on children in our community. And before I turn to that conversation about, frankly, the harm that I believe is going to be occurring as a result of H.R. 1 in many of our communities, I want to just tell you a little bit about myself. I'm not just an elected official who sits on a committee with jurisdiction over the SNAP program, our nation's most effective anti-hunger program, but I'm an American who grew up in a mobile home park. In fact, we lived in 4 or 5 mobile home parks growing up. And my mother always says, yes, but only 3 mobile homes. Along with my siblings, my brother and sister, my mom was a single mom who raised us with the help of my grandmother. My mom went to school for 9 years while working a couple of jobs to help put food on our table, and over 9 years, she went one class at a time, one junior college, one community college class at a time to become a public school teacher in this country. My life story is one that would not have been enabled without access to the SNAP program, at the time food stamps, or to WIC. My own personal story of being able to grow up in a family that needed just a little bit of help. Growing up in a family without access to health care, to dental care, all of these things that real experiences are occurring in our country every single day, still today. There were times when we needed, sure, assistance to make sure that our family could eat, but I stand before you today, right down the hall from my office, where I have the privilege of advocating now for hardworking Minnesotans who need just a little help themselves so that they don't fall through the cracks. Would I be here if my mom, as hard as she worked, as much as she loved us, hadn't been able to keep food on the table? I can't answer that question to you. I don't know. But what I do know is that no child in this country, no family working hard for economic opportunity should be denied that opportunity in our country. People listen to me now when I ask questions, mostly because I'm a member of Congress. But I think about every single American, every caregiver of a child, every single parent, every child on a free school lunch, which of course we needed as well growing up. Every former foster youth who's currently having the food taken away, having stories out there. And don't forget that, sadly, as you talk about H.R. 1, it could be worse. Republicans in the House, they wanted to put work requirements on any individual who had a child that was 7 years or older. I know they landed on 14, but they wanted it at 7 in the bill that came out of the United States House of Representatives. The cruelty just dismays me every single day as I come to work here. Look, these lives and well-being of our neighbors, they are important. And in many cases, they could be any one of us. The ability to grow up big and strong, to focus on school, to hit their early childhood development milestones are just as important as tax breaks for the damn top 2% in this country. And that's where I stand today, on the brink of having fought these cuts, $186 billion to the SNAP program, this state cost shift. If I had $1 for every time my colleagues on the other side of the aisle use the words unfunded mandate to talk about what we do here, well, this is an unfunded mandate to the states. And in 10 states across this country, it doesn't even fall to the state level. It falls to the county level. And in Minnesota right now, people are freaking out because they're getting their new tax bill and the taxes are going up, property taxes 15%, 10%. And they're like, what the hell? And I'm, well, thank a Republican today. I'm sorry, I have been one of the most bipartisan members of Congress. I come from one of the most evenly divided districts in America. I always say it's a third Democrat, a third Republican, and a third of my constituents don't like Democrats or Republicans. But that puts me in a unique position to be able to talk to people across the political spectrum about what damage is being done to families and to children as a result of H.R. 1. You know, before H.R. 1 became law, SNAP helped feed 16 million children a year. Now states across this country are predicting budget and funding shortfalls due to this $65 billion unfunded mandate that is now law. Shifts costs for food assistance and program administration to the states. It's cruel, it's heartless, it robs young people who are at this very moment growing up in mobile home parks across this country, in cramped apartments, and in homeless shelters, robs them of a brighter future. The damage H.R. 1 does to child nutrition doesn't stop at SNAP either, because SNAP eligibility informs whether entire school districts qualify for free and reduced lunch. And it makes it easier for mothers and infants to get access to WIC. We cannot allow this to stand in the long run in this country. Last week, my colleagues and I introduced a bill that would delay the cost shift to states by 4 years. My Republican colleagues called it silly out loud. Silly. Oh, it's silly to stop this unfunded mandate to the states. I'm going to tell them that the next time they say those words out loud. This bill would delay for 4 years, and that is the bare minimum to give states and counties breathing room to respond to this inconsistent and irresponsible decision made by this administration. And don't forget, all this cost shift is based on error rate. Well, let's go back to the government shutdown. First, USDA said, get out the benefits. Then they said, don't do the benefits. Then they said, this is all like in 72 hours, do partial payments. Do they believe that that did not increase the error rates across states, Republican and Democratic-led states across this country? These are challenging times, and I'm so grateful to First Focus on Children for being a voice to those who are negatively impacted by this law, the children whose food assistance is literally being taken from them. We must be relentless in our efforts to restore food security in this country. Our children, our future, our families deserve nothing less. Thank you so much.
Thank you, Congresswoman. Okay, turning back. Gabrielle, putting you back on stage here to finish up, and I was thinking, listening to the Congresswoman, and wanted to ask you, So with the situation in New Mexico and the different trust funds, what is the projection on that? Like, when do you start to think we've got to move again to keep us whole and keep us the second?
Yeah,
Well,
so that's a really good segue into the next thing I was going to talk about. Because we're so dependent on federal funding, and while we have a ton of money in reserves and our trust funds, we're reminding our lawmakers that just because it's bad now doesn't mean we can't both be responsible and not take the foot off the gas on childhood well-being. And it's an interesting position to be in because we can already see our lawmakers saying, let's not spend that 2% out of our reserves to make universal child care a reality. In New Mexico, let's do co-pays. And the arguments we're trying to make right now are, is that 2% gonna really mean anything or make the difference when things get hard? Or is part of our job right now to make people believe that government is here to help working people? And so I think that we're gonna be financially well off. We can't meet the gap forever because a third of our budget is federally funded. And I think the other thing too is we're starting to move the needle on childhood well-being. And so we have to continue to move in the direction and look at policies that not only do the thing that we're really proud of. So New Mexico's policies right now show that we have the biggest delta between our official poverty measure and our supplemental poverty measure. Just so I could get a feel for the room, how many of you know the difference between the SPM and OPM? One person. I love you. You must be so nerdy. I love it. Look up the difference between supplemental poverty measure and official poverty measure. And I think what's so amazing about New Mexico is that our official poverty measure is really high. It's 27%, but our supplemental poverty measure is 9%. And what that number tells you is the work New Mexico has done in progressive policymaking that makes sure that kids have access to SNAP, Medicaid, amazing working family tax credits and earned income tax credits, but we haven't fixed wages and wealth inequality. And so some of the things that I'm really curious about is as we're making universal child care real, and there's, hundreds of millions of dollars going into our economy, how is that showing up in wages for early childhood workers? So we're looking at a wage and career ladder bill this year that would make a floor of $18 for child care workers, addresses the economy. I think the other thing that we really want to push for is let's look at our state investment council. Those are the people in charge of that $68 billion. How is that getting invested in New Mexico's economy? So it's not just policies and government spending, but the investments we're making to make wages competitive in New Mexico. And then the last thing I'll say is, how are we getting creative also about what ownership looks like for those early childhood centers? So how can we push for cooperative models and structures? I said that was my last thing. The other really cool thing is also municipal policies. We only do state level work, but the mayor of Santa Fe on his way out passed an ordinance that indexed minimum wage to the cost of housing in Santa Fe, which is really forward-looking. And so we can't just look at how we're meeting the gaps to make sure that people have their food and their health care, but how we're also addressing economic inequality in really innovative ways and making sure that our lawmakers don't rest on the fact that we have that $68 billion earning interest. We do need to be smart about the economy and also our tax code, because we haven't decoupled, and New Mexico Voices for Children with our partners at State Revenue Alliance are the groups pushing that forward this year. It's not lawmakers, because that $200 million, that ain't nothing. And so we still care about tax equity, even though we have a lot of money in the bank earning interest. So thank you.
I appreciate that, and I appreciate you making the links between all the different aspects and policy levers that impact children and their families. So Tramel, tell us what's happening in Louisiana.
So good morning. Can everyone hear me okay?
Yeah.
So first, I will give a lot of doom and gloom for Louisiana, but let me start by saying I do love Louisiana. We have great food. It's a great community. You should always visit Louisiana. So I think part of this conversation, a lot of things have been covered. When I think about Louisiana, I think about over 50% of our budget, or just about 50% of our budget, comes from federal dollars. So when we talk about shifting costs, like we don't really have money to plug those gaps that will be coming down to the state of Louisiana. I'm concerned as a former educator when I think about SNAP cuts. I was a school board member in the second largest school district in East Baton Rouge Parish. 80% of our school district was free and reduced lunch. And so you're talking about literally the difference between a student missing the bus and not having a meal until lunchtime, and a student eating at all. And so those are the type of things that are the top of mind for me when I think about these cuts. I'm also thinking about we've kind of dealt with it's almost like watching the same movie over again. A couple of years, well, maybe 8 years ago, when we had Bobby Jindal as our governor, we had public higher education institutions running as if they were private institutions, meaning that every cut that we needed to balance our budget came either from higher education or our healthcare, which are the two unprotected classes in our state constitution. So I'm thinking about some of our historically black colleges and universities who are already underfunded, who have already lack investment for infrastructure development, who will now be able to run or have to run as private institutions. So I'm thinking about those kind of things. We have over 1 million people who rely on Medicaid for any kind of health care access. Growing up, I was one of those kids who relied on Medicaid for preventative care. And so now we're going to overwhelm our emergency departments for folks trying to get access to health care. And I think the reality for Louisiana is we rely on two things: task force and one-time funding. We will have a task force to tell us what type of water to drink and one-time funding to spend on random things. And so we as a state have not taken proactive measures to decide on what kind of things are we going to be doing as it relates to these cuts in H.R. 1 passage. And so I'm concerned, and at Trust Louisiana, we're concerned about the intersectionality with these cuts in education. A lot of times we talk about SNAP and Medicaid and silos, but they are directly impacting what happens inside of our school systems, inside of our schools. Some of our schools have health-based services on campus, which means that students can come to school and get all of the preventative care that they need without having to leave the school building. If this continues without any repeal, those students no longer have access to health care. We have mental health supports. As you know, across the state, the country, we're in a mental health crisis. Many of our students have mental health counselors who come on campus to provide services to them. If we continue with this, those services are no longer there. And so I think top of mind for us in our advocacy is how do we get to the intersectionality of this and not look at SNAP and Medicaid cuts in silos, but their impact on education, especially when we know that there are unprotected classes, education and health in our state. And then the last thing that I will say is that our state has tried several times to do system shifts to get into the 21st century, because believe it or not, we live in like the 15th century somewhere. And so the cost that it happens for us to just get systems to be able to read the new requirements is almost would bankrupt us. The amount of support and capacity building that we have to do as a state in order to just be able to understand eligibility is going to be a problem for us. And so that's a lot of concerns. And I think our state is right now, our governor is like, we have a LA Doge who've reportedly covered $14 million in SNAP era. We have supported supposedly all of these cost savings, but no one knows are these cost savings real, where they're coming from, and then how are we going to use them to plug our gaps with costs from the H.R. 1 cuts. So I'm really concerned, and our state has not been a proactive state for a very long time. And so I'm concerned that we will be reacting to a lot of this, and we will see a lot of people, everyday people in Louisiana, hurt because of what's happening with H.R. 1.
And Tramel, do you think things will happen at a more local level? Will there be mayors and parishes that are taking proactive steps?
Yeah, there's a lot of hope, and I know we are also a 501c3 organization, so we don't really intertwine with elected work, but I think that matters. As a former elected official, I know how much it matters, and so I'm really hopeful that our new mayor in New Orleans, Helena Marino, is going to take a proactive, progressive stance on filling some of these plugs. And so goes New Orleans, so goes the state of Louisiana, and so that is our our point of hope. I'm hopeful that because of tourism revenue, they have really creative ways to generate new revenue streams, which the state sometimes relies on New Orleans revenue in order for us to fill gaps. So that gives me a simmer of hope with local elected mayors who have a proactive, progressive stance to because when we talk about raising revenues, it's not popular in Louisiana in our state legislature. You're talking about a legislator that is a supermajority Republican, so raising new revenues is almost unheard of with a supermajority Republican legislator. And so my glimmer of hope comes from places like New Orleans, who have always been progressive in the state of Louisiana and have very innovative ways to raise and generate revenues for our state.
Can I say
Yeah.
something about the state of public education? Like, as you
Yep.
were talking, it just reminded me of how interconnected all of this is.
Yeah.
Right? So these cuts to Medicaid and to SNAP and in HR 1 are directly impacting lots of different school systems because so many kids receive free and reduced lunch,
Correct.
and because so many school districts rely on this process, direct certification, to determine which kids are eligible, and then how much money that goes to the school district is, related to that number of kids, right? So there's a direct relationship there, and Louisiana is one of 6 states that actually relies exclusively on direct certification for their funding formula for K-12, so that's a problem, right? But at the same time, across the country, we are seeing in almost every state that they are passing universal school vouchers that are making it so that people can take what was public money out of their state general funds and use that money to apply to attend a private school, right? Often also religious schools. And what we have also seen from the states that have already moved this forward is that those vouchers are going primarily to families that were already attending those private
Correct.
schools,
Yeah.
right? Because states are passing universal vouchers and there are no income limits, there are no limits based on your family circumstances, that money is essentially just being siphoned out of the public general funds and given to private, already wealthy families, because also those private schools are just increasing the tuition
Absolutely.
accordingly, right? So that is happening, and states are also continuing to pass property tax cuts and putting caps on their property taxes at the local level, so that localities that even want to try for some different sorts of ways to raise revenue aren't able to do it, right? And that is defunding public schools as well.
Yeah.
So I think that there is an attack on public schooling that is happening that is simultaneous to what is going on with people's access to health care and to food assistance that really needs to be paid attention to as well, because all of this is interrelated across the tax system and the healthcare system and the education system.
Yeah, I would just add to that for Louisiana. We just, during our last legislative cycle, we passed the Louisiana Gator Program, which is essentially that. It is our universal voucher program for students in Louisiana. On the same token, there has been no dollar amount appropriated to this program, but we are expecting or anticipating during this legislative session that there will be some kind of dollar amount appropriated to that, which then takes away from us or our ability to cost share in other areas. To your point about the taxes, we have also an ITEP program, which is our industrial tax exemption program. Usually, the locals were able to vote on it, meaning local school boards, local sheriffs were able to vote to decide when a new business is coming in, how much of the allocated tax exemption would they be allowed. Our state has since taken that power away from locales, and so now there's only an ITEP board that approves all ITEP exemptions that come through our state. So when you talk about raising revenues and generating new revenues, our state has continuously taking away power from locales to make those decisions that will now impact them. So it is a whirlwind, a domino effect of things and decisions made in order to protect, to our point earlier, the 2%. So it's a tough battle in Louisiana. And as you think about being innovative and creating, generating revenues, every time states or locales try to, or locales or municipals try to, you have states who take that power back from them. So that's one of the fights that continues to be a fight too.
Yeah.
In Oklahoma, that's exacerbated. We're the only state in the country whose municipalities exist solely on sales tax. They are denied access to any property revenues at all, just sales tax, which in spite of that, Oklahoma City and Tulsa are both thriving municipalities, but it definitely limits the municipal response and hinders their ability to participate in any local solution.
Please.
Well, I'm going to ask this, but you might be ready to answer it already. I grew up in a very rural part of Michigan's Upper Peninsula. Well, it's all rural up there, right? And what I think I'm hearing is that the impacts are not going to be evenly spread across the country. There will be certain communities that will feel the pain first, and maybe you were going to speak to that a little bit, but I'd appreciate if you all would talk through that a little bit.
Certainly. So I'll say it just speaking about rural communities specifically, and then, I mean, even within rural communities, we could talk about communities of color, we could talk about tribal communities specifically among rural communities, but rural areas tend to have higher rates of Medicaid and SNAP participation than urban areas, so they are obviously going to be more affected by the cuts in HR 1, but there are a lot of different ways that would happen, right? So there's the direct loss of coverage and benefits, but rural areas also tend to be areas where there's limited transportation for people, right? So it might be more difficult for people to be able to check in and to verify their eligibility. There also tends to be less access to clear Wi-Fi and internet service, right? So that is going to make things more difficult for people. And also, rural areas tend to already start with just fewer resources, right? So you might have one local hospital, you might have one school system that is serving a really large area. And if these cuts are impacting that hospital, that school, in a really negative way and making it difficult for them to provide services and it shuts down, or the school district doesn't have enough kids that are, attending and paying enough and they have to be bused to other places, those are costs that are now being shifted onto the state, onto the locality, and there is no way in a lot of places, to the points that we were just talking about, to raise that money and to bring it back.
Yeah.
That brings together, for me, a story. I served in the Oklahoma State Senate, and there's a small community in rural Kingfisher County that has a local grocery store. It's a rarity. But for this grocery store, the entire county is a food desert. Locally owned. Approximately half of the revenue in that particular business is generated by the SNAP program. Without that revenue, that business does not survive. And I think those trickle-down effects are the ones, we will see them very quickly in rural, isolated communities. It'll happen very fast. In the urban areas, it'll take a little bit longer to see that, but it is also the economic impact of any shift in both of these programs. We have counties where the largest employer is the healthcare provider. A loss of revenue to the healthcare provider means a loss of jobs, loss of local income. The trickle down is significant. And rural areas, the underserved, but in particular isolated communities are going to feel it the first and the hardest.
Yeah, and in New Mexico, what I'll add to that is rural and frontier communities are a large part of our state. We're, I think, the 5th largest landmass in the nation. One of the things that we've been highlighting is if our rural hospitals, I think there was a threat of 6 of them closing down completely, is that everyone in that area loses coverage if there's no longer Medicaid funding, and it's like pulling a thread, right? What happens is then families who can't or can afford to come to, say, Albuquerque to have their baby, that just increases demand in an already strained urban system. The other thing, too, about costs that we've been talking to our congressional delegation is taking into account that most people can't even afford a $400 emergency. So if you have to come from Gallup 3 hours away to Albuquerque to have a baby and stay in a hotel room for 4 or 5 days, or you have some sort of other medical emergency, families just can't afford to make those kind of trips to take care of their health.
Yeah, I think that I will add, just when you think about the rural communities in any area of work that we work on. So, for example, we recently passed a dual enrollment bill, and so it created pathway opportunities for high school students. One of the biggest things that I think were like the unintended consequences is like, yes, we've now created a pathway through policy where students have access to dual enrollment, but when you go into the rural communities, some of them are now within 200 miles of a local college or university. And so when you think about rural communities, they're already in isolation. They're already doing all of this work in isolation. And so when you continue to cut, to your point, we have rural hospitals that will close. Over 357,000 people in Louisiana rely on some form of Medicaid. And so we will have rural hospitals close. We will have people who no longer have access to a hospital. And even the folks who have access may be, to your point, 100 miles away. When I think about food deserts, we have urban communities in the Black community right now in Louisiana who are already considered food deserts. We had a local mayor who had an initiative with like the Dollar Generals of the world, to get them to start providing fresh fruit options, because those were more prominent in a urban community than there were local grocery stores. So we already have these issues existing in Louisiana, and so these kind of cuts just makes the problem worse. And so it's going to take a lot of hard work and a lot of diligent people working on this to ensure that people just have the basic necessities to survive throughout this time.
So I have a two-part closer for you all. Excuse me. So I'm reminding myself of the fact that we know investments in children, that those investments work. We saw that in 2021 when we made significant investments in kids and their families, starting with the significantly improved and expanded child tax credit, but also childcare investments, education investments, nutrition investments, and poverty was cut nearly in half. So we know what works. Now we've been talking about HR 1, obviously, the complexity of it, the harm that we're anticipating, who may feel the pain first and the longest, and some of the ways that maybe we can address them, mitigate the harm, or find other ways to proceed. So I have two things that I would say. What would your advice be to the group to make sure that kids are centered in this conversation? And secondly, if you have 30 seconds with your member of Congress before you leave today, what would you say to them in terms of what you might like to see the federal government do?
I'll start this time. I think the first thing that I'll say to this group, and I think that I would say to any advocate in the room, is that we have to be more proximate to the issues and proximate to the people who are impacted by the issues. As advocates, we oftentimes spend a lot of our time telling numbers and telling stories. But with AI and all these things, people can pull up numbers across the board. We have to tell the stories of real people, and we have to do a better job of elevating and amplifying those stories of real people. So that would be my message to this group. Become proximate to the issue and become proximate to the people who are being impacted by these issues. If I would have a word with my congressman, I think I would say we should take every attempt in future legislation to repeal, because we have to understand that the cost sharing that these states are going to have is almost impossible. It's impossible for a state like Louisiana to continue to make these investments into these programs in order to ensure that people have basic necessity and needs.
Thank you.
Ditto to your first one, and what I'll add is don't stop dreaming and working for the bold policies while you're also still protecting what people are owed. And why I say that is because I really believe this is the moment where we have to make people believe that government can do good things for working people again. And so while you're defending and protecting, figure out what you can push through that's bold and really makes people's lives better in the immediate future. I would just say thank you to my congressional delegation. I don't know what I'd ask them for. I would say, yeah, keep up the fight, and I would love for them to push in New Mexico for us to continue to expand our view beyond the oil and gas industry in how we raise revenue, and to understand that there are other ways for us to maintain our wealth in New Mexico.
Thank you.
If you need further proof of the significance of investments in the first 1,000 days of a child's life, I mean, I got 5,000, 6,000 studies I can show you. I mean, we have proven that it pays for itself in the long run. We've proven it over and over and over. So let's not ignore the academic fact that's been shown before us. And then just a real tangible thing. I have yet to meet a bureaucrat who wanted to make mistakes. Like, I really haven't. These folks want to do their paperwork correctly. On the error rate, it's a reasonable request for us to get this right, but allow them time to put their heads together and create the systems necessary in order to meet the goal. You're grading the test after the work's already been done, and that isn't sound policy at all.
Thank you.
Absolutely. So I live in D.C., so I'll just say to all of the Congress people, I think, obviously, repeal, right? Like, repeal, if there is even a chance that you might have a little bit of consensus around this, like, take it back. It is not too late to say that this is bad policy and it does not work and it is harmful and we don't have to do this. If that's not going to happen, I definitely think we should push for a delay in the cost shift for SNAP. The original bill included a 2-year delay that was meant to really accommodate some states that had later budget timelines. I think all states have realized now how much they need that additional time. And so in addition to pushing for a delay of the cost shift, also just refuse any calls to further cut Medicaid or SNAP or any of the other basic needs programs in order to pay for tax cuts or any other spending priorities. We have been up here talking about all of these different cascading effects that happen from just the cuts to those programs, and we cannot continue acting like that is a viable source of funding for the federal government. And then I think to all of you, I would just say that, like, if you work on a specific issue area, if you cover a certain topic in your office or in your work day to day, now is just not the time to retreat into your issue silos. Like, you have got to make new friends, right? We have got to get out together talking about how these things work together, because there is an interconnectedness of the harm that has to be elevated, I think, for our lawmakers to understand how bad this really is. And this is a great time to be able to find some bridges.
I very much appreciate that, and I think that was an advertisement for the work we do at First Focus too, and we love working with you all as well. Thank you. This was a very, very helpful and important discussion. I appreciate you all taking time out of your busy work weeks to join us. I think on behalf of First Focus on Children, thank you all, and we'll pause now, and we have the Congressman. Yep. We have a new special guest, and then we'll get to the second panel on SNAP. Thank you. Thank you.
All right, thank you to our first panel, and thank you to my colleague Michelle Dallafour for organizing that. That was fantastic. Congressional vote schedules being what they are, actually, here's a surprise to the schedule. We have our next speaker with us right now. So it is my pleasure now to introduce a leader in Congress whose work goes straight to the heart of how Washington can deliver for families, farmers, and rural communities. Congressman Shamari Figures represents Alabama's 2nd Congressional District with energy, expertise, and a deep commitment to food and nutrition policy. Serving on the House Agriculture Committee, he plays a critical role in shaping nutrition policy that affects millions of Americans. He's fighting to protect SNAP and other essential nutrition programs, ensuring they are responsive to the needs of working families and resilient rural communities. His work emphasizes that nutrition support is not merely a safety net, but a foundation for economic stability, public health, and local markets, from food banks in urban centers to farms across the industrial heartland. Raised in Mobile, Alabama, and driven by a lifetime of public service, some of which I've had the good fortune of seeing from the next cubicle over, I know he brings to his work a perspective that is deeply rooted in his devotion to the people and places of his home state. But today we're very pleased to have him with us right here in DC. Please join me in welcoming Congressman Shamari Figures.
Oh, thank you, Chad. Chad and I had the privilege of working along with this woman, which is why I walked across and hugged her. We're all veterans from Sherrod Brown's office, who served on Senate Ag for some time. So a lot of the work that we do is literally grounded in an understanding that we had going back to being colleagues, not that long ago, literally just a few years ago. Seems so weird to be in Congress now. But I'm Shamari Figures. I represent kind of hard to geographically describe it. It's almost like the southern fourth of the state minus the counties that border Florida and Alabama. But the cities that most people have only heard of in my district are Mobile, Montgomery, and Tuskegee. But I also represent some very rural parts of the state of Alabama, Tuskegee being one of them, but Troy, birthplace of John Lewis, Monroeville, hometown of Harper Lee for the literary fans in the building. And also a little city called Clayton, Alabama that I learned when I got here is actually the birthplace of Katherine Jackson, which is Michael Jackson's mother. So, yeah, that's my district, all right? So you're welcome. And Tim Cook is from my district as well, believe it or not, to the iPhone lovers. But the realities of my district, yes, we have plenty of very cool people from my district, including Lionel Richie as well. But we represent a very, it's a very economically depressed district, pound for pound. Just when you look at the total landscape of my district, I represent 13 counties. 2 of them, Mobile and Montgomery, are the quote-unquote urban counties. That's Alabama urban standards, right? But then we have 11 completely rural counties. And these are counties that most people have never heard of in this room. But across my district, including Montgomery and Mobile, the average individual median income is just north of $32,000 in my district. And to put that another way, that means for people who file tax returns in my district, more than, or 50% of them make less than $32,000 a year, which is insane to think of. It almost sounds, too unreal to be true. I'm sure somebody will Google it to make sure I'm telling the truth. But that's the realities of life in places like Union Springs, Alabama, and Evergreen, Alabama, and Clayton, Alabama. And what that leads to at the end of the day is a situation where we have about 1 in 4 households in my district are SNAP beneficiaries. About 1 in 4. It's one of the highest rates in the country. And that's because of the economic realities of what takes place in my district. And that is, those statistics are replicated in some shape, form, or fashion across the country, across communities where many of you guys are from. But there's a common solution to it, which has historically been this country standing behind the people who need those benefits the most, which is actually only, it's only $6 a day. It's only $6 a day. In fact, when we were in Senator Brown's office, I don't know if you remember this, he made us read Michelle's book, $2 a day, which if you've never read, what's Michelle's last name? Oh, Kathy Egan, $2 a day. I'm sorry, I'm thinking of Carter's wife. But he made us read, yes, but he made us read this book, which really at the time amplified like the struggle that people outside of the bubbles that we live in, that they face. And I mean, in the state of Alabama, 750,000 people receive SNAP benefits, of which over 300,000 of them are children. And for us to be up here pushing policies that don't reflect the realities of life on the ground for so many people was a very disheartening process. We warned Republicans. We told them we'd end up exactly kind of where we are right now. We knew that the cuts would be drastic. We knew that they were just very, mean-spirited, and just at the end of the day did not have a reflection of what life is like for so many people. And I say this in every room I go in, but we're not talking about black people, or just Latino people. The majority of SNAP beneficiaries are not minorities. And it's something that affects, and I say that to say that it affects, people from all different backgrounds. But the one common theme that they have is poverty. And it's something that we should be committed to rectifying, something that we should be committed to addressing in a responsible way, a more responsible way than putting the burden on states to come up with money that historically they have not had to come up with. I was just talking out, my team is here with me. I have Kyla Cole, who does all of my ag policy and all of my SNAP policy, my chief of staff, Tristan's here, and Prashana is here. We also have our intern, Mariana, here with us as well. And she goes to the University of Alabama just like me. But but I was talking with Kyla out in the hall, and I was like, we were just reviewing some statistics, and I'm like, does this number keep changing? She's like, yeah, it does. And it's not because of bad staffing. It's because of when you rush through bill processes, when you rush through substantial changes, the numbers you get back originally are, pretty good estimates, but until the stuff hits the fan, you don't really get an understanding of what the true statistical or the true data points that are impacting these changes are going to be. And so a state like Alabama, we've been asked to come up with $250 million to contribute towards the SNAP program. And if we don't, and here's the scary part, if we don't do that, if we can't do that, if we choose not to do that, the state legislature, for whatever reason, chooses not to do that, then the program itself, for the first time in history, can be eliminated. And that's not something that's unique to Alabama. That's in all 50 states that participate in the SNAP program now. And if you cannot, for whatever reason, meet the cost-sharing program, then you don't have the guarantee of the federal cost-sharing money coming into your state and to your communities. And that would be devastating for many places in our country, certainly in my district. And so it's something that we continue to push back against, we continue to fight for. The delay in implementation of this cost sharing is something that I think is critical. It's not the ideal policy solution, but it's the only thing that we can ask for now given where we are. And so we're going to continue pushing for that, continue fighting for that. And with organizations and people like you guys here in this room, we'll make sure that we are doing so in an informed way and in a way that best reflects communities across this country and brings to light the real stories and real people and real communities that are being impacted by what's going on here now. And so with that, I'm going to do something that I don't think was planned, but I am willing, if I have permission, to take a few questions, if anybody has any questions. Well, we're no longer taking questions after that, because I don't. No, but if anyone has any questions, I am more than happy to take any. I'm sorry. Against the advice of staff. Yes.
What's the biggest threat to children in the state of Alabama from HR 1?
Children specifically from HR 1 specifically. May not be an answer you would expect to hear, but for me, it's actually education related. The reason I say that is because one thing that HR 1 did that did not get a lot of fanfare, did not get a lot of press coverage, has not been, I mean, there was so many bad things that you got to kind of pick and choose what you scream and shout about. But it, for the first time, imposed lifetime loan limits for kids going to college. Lifetime loan limits, which has never been an issue. There's never been an American scandal about people taking out too much money to go to college. And then it also went a step further and imposed caps that you could actually take out in pursuit of professional degrees. Let's just take doctors, for instance. The most dangerous part about it was that the caps, two things about them. First, the caps are lower than the average cost of a medical degree right now. Secondly, they didn't tie the cap to inflation. And so what that means is everybody that's either in college or going to college or been to college, the cost of tuition generally goes up about 2.5%, 3% a year. So that means that as the cost of a medical degree continues to rise, which it will, the cap for what you can borrow to go help get a medical degree stays the same. So the delta rises, which means that every year, with every tuition hike, the number of people who are who can realistically afford to go to medical school drops drastically. And to me, what that means is that we've reverted to a world where it's no longer true to look at your kids in the eyes and say you can be whatever you want to be when you grow up. If you come from my district, where the individual median income is just north of $32,000. Now that is modified into a statement of, well, you can be whatever we can afford for you to be at the time. And that is damaging on so many levels to children that I can't even begin to quantify that into words. Like it is terrible. Like it is truly terrible. And I think that poses a significant threat to the long-term attainability, the long-term goals that kids will set, like when it becomes the reality that, I can't afford to go to school, right? I can't afford to become a doctor. I can't afford to become a lawyer. Mama doesn't have the money tucked away. Daddy doesn't have the money tucked away. Not going to come into some mass inheritance. It just really sucks to be able to look at to kids that are getting ready to go to school and say, the federal government will no longer be there if you do all of the things that we expect people who become doctors to do. You go to class, you succeed, you stay out of trouble, you do well in school, you get good grades, you participate in the extracurricular activities, all the things that make a college and grad school applicant attractive. It's not about that anymore. Those are no longer the primary factors. The primary reality for kids across this country from all types of communities, especially from poorer communities, is going to be you can't become a doctor. Because you can't afford it. And that is a sad place to be in, particularly when it wasn't responsive to any, scandal or problem that we had nationwide. It was literally done to make the numbers match up, because HR 1 was passed through this process called reconciliation, which is this weird little, rob Peter to pay Paul sort of numbers game, smoke and mirrors numbers game. They did it just for that reason, to make numbers work. That's what I would say. Yes, sir.
So we spent the last hour talking about, to your point, the doom and gloom, the realities for states like Louisiana, where I'm from. What continues to give you hope, and like, what are you most excited about in the near future?
Yeah, the part that gives me hope is I'm black and I'm from Alabama, right? And what I mean by that is, when you talk about like the pursuit of democracy, when you talk about like my favorite Martin Luther King quote was always say to Americans, be true to what you said on paper. When you think about that, I think that quote just sums up the civil rights movement in like a single quote. When you think about that and coming from Alabama, you know that the days were much darker than we're in now. Like they were, right? Things are bad, right? And I'm not, minimizing that at all. But I mean, I had, my father integrated Alabama's law school. He was the first black to be educated in a law school in the state of Alabama. His brother, just a couple years before that, was told, you can't come to law school here unless you send us a picture, right? That's not the threats that we are facing now, right? That's not the type of environment that we're in, right? And so what gives me hope is knowing how dark the days were, how violent the days were, how little of a voice, how little of representation certain communities had, not just black people, Latino people, AAPI, poor people in general, how little voice in government they had in the 1940s and 50s and 60s, and the progress that they were able to make organizing then without one of these, right? Without a cell phone, without social media. That gives me hope that we can organize and galvanize people in a way to bring about the type of change that they brought about. That being said, what I'm most excited about right now, and I'll tell you the other thing I think, being here, I think a lot of people operate out of fear, like I do, right? I think that I don't think a lot of people believe the stuff that they are voting for. I genuinely don't. But they operate out of fear, right? And that's, it leads to even worse results, right? In a lot of circumstances. The biggest fear factor is down at 1600 Pennsylvania Avenue, right? So what also gives me hope is that there can't be a third term, and the fear factor, well, at least we think there can't be a third term, right? But the fear factor, dissipates, right? And I think there's some, I could go on and on about it, but what I'm most excited about, right now is leveraging this opportunity that we have to be in this seat. Because there's still, despite how bad things are, there's still ways to seek out progress on some things that will bring a positive impact to the communities I represent and some of the communities that you guys live in. There's still, to use an Alabama football analogy, there's still ways to move the ball on a wet field, right? And so it's, so that's what I'm most excited about, is like, even in this current environment, how can we navigate it in a way to squeeze as much blood from the turnip as we can, even in these tough circumstances. I think I saw you first, then you, and then they're probably gonna make me leave after that, but let's see. Yes.
Puna, also a Sherrod Brown alumni.
Nice.
But from a very long time.
All right.
And thank you for bringing up education. I know we have a lot of concerns about the impact of HR 1 also in the K-12 space, specifically around financing and free and reduced lunch
Yeah.
eligibility, the way that Medicaid actually finances schools and how that school impacts in that space as well. But the question is much broader. It's nice to hear a glimmer of hope, but I'm wondering if you have any concrete advice for this room, which is a lot of advocates from a lot of different kind of areas of policy that do impact children and families.
Yeah, it's a tough environment right now. Like, it really is, and I know it's discouraging. And I know when every day you turn on the TV, there's something that's even more discouraging than before. I think the advice is to look at the stories of people, some of you who may have these stories, right, of people who wouldn't be where they are if it was not for the progress that has been made in the past with this country to give you opportunities. We can get back there, right? And if you could convince you know, if people, I am convinced that if you could convince people who literally came of age in a Jim Crow, anti-woman, you know, anti-poverty sort of policy-centric mold in this country, to get the type of successes that we had, whether it was through a Civil Rights Act or a Fair Housing Act or an Education Act or Voting Rights Act, I remain optimistic that we can do it. In terms of advice, I think it's to look to those people, look to those strategies. I think a lot of times now, I think what we're guilty of is we see the results of those movements, but we don't understand the struggle. We see the mountaintops, but we don't see and understand the climb to the top of that mountain. You know, Martin Luther King is glamorized now as accomplishing all of these things from a civil rights perspective. But we weren't there when Martin Luther King was losing the court battles. We weren't there seeing, you know, the literal death threats and the literal setbacks to a movement. And, you know, every movement has its setbacks. And so I think, you know, realizing and understanding that is the best advice that I can give at this point, and to just keep damn going, right? Because we can't stop. Right? Because if we do stop, we have a very clear playbook in front of us in terms of where we will end up. If we don't stop speaking up for what's right and what's just and calling out what's wrong and what's corrupt and what's leaving people behind. You know, at the end of the day, like a lot of these policies, like they are exacerbating wealth gaps and attainment gaps. At the end of the day, that's in large part what a lot of this stuff boils down to, is that it is increasing the opportunities, or decreasing, I'm sorry, the opportunities for people who don't come from certain income levels. And that is, you know, as you continue to stack those policies on top of one another, you're ultimately going to end up in a situation, you know, where we've been where we were before. And that is not where we want to go. I think I saw you and then you.
So kind of a follow-up to that. So in your experience, because we're always told messaging how to talk to lawmakers. And so for the people on the other side that you see there's kind of a glimmer of hope there, what are some of the things that are kind of moving them to want to, you know, say, we want to vote for things that protect children? Because we know there's some that are not going to do that.
Yeah.
So what has been your experience with people, and what's been some of the issues that have motivated them or gotten them to at least consider?
So there's one rule in the House at the end of the day, and that's that 218 wins, right? 218 votes wins, right? No matter how you get there. We just saw this most recently with the discharge petitions around the healthcare subsidies, and you can look to that example as something that, you know, where we just recently saw success in people seeing the value and standing up for healthcare, right? One would think that you wouldn't have to explain this, but it took that, right? It took boiling down these issues to a localized impact, right? And that is what I have found most successful. I view this job as very locally centric. I view the role of a congressman as like a glorified, in some sense, city councilman, right? Your priority is your district. That's what I think it should be, right? And so I really focus on things that impact the district. Like the question that I always ask my teams, what's the first question I ask? How does it impact the district? That's how I operate, right? That's how I operate. When we worked in Sherrod Brown's office, he has a whole state, so it's not just a district. So his thing was, how does this impact workers? Which is a very informative and very insightful way to analyze policy through as well. But I think it's localizing things in a way where they understand it. I think people come to Congress, in my sense, hey, what do I know? I'm just a rookie. I just got here, right? I think they come to Congress and think instantly that their job is to be like this national political figure that's, you know, responsible for, you know, either creating or preserving these national interests. And it ain't your job, right? It's not your job. Your job is to go up there and represent the 750,000-ish people that are in each of our districts. And so I think when you localize it in a way and be able to get to the local advocates and grow and expand that sort of local presence of an issue, it creates the type of pressure on members that members don't like to get if they're on the wrong side of an issue. And so that's what I would say. It's figuring out ways to localize these things. Yes, ma'am.
So this is kind of a two-part question. said that you said 750,000 people in Alabama receive SNAP. And as you mentioned, too, contrary to popular belief, that number doesn't always encompass a majority of marginalized individuals. So obviously, there's some stigma there, so which has hindered, actual change being able to be facilitated. So I guess my question is, what policy areas that are affected by HR 1 do you expect to be harder to push for change due to stigmatization and like shifting public opinion?
So to understand HR 1, you got to understand procedure here at the House. It was passed through a process called reconciliation, which, summing up reconciliation very simply, basically means you have to shift money around to end up with a targeted number that they set over a 10-year period, right? Over a 10-year period. And so to do that, you have to touch, the easiest way to do it is to touch the largest pots of federal money, right? SNAP is one of those large pots. Defense is one of those large pots, but they didn't, no, I don't want to touch defense, right? Tax revenue is the largest of those pots, right? And so as strange as this is to say, it's a numbers game to them, right? It was a numbers game. It's the primary objective being we want lower taxes for very wealthy people, right? That was their primary objective. So how do we get there? Well, in this process of reconciliation, if you decrease the tax revenue, you got to ramp up the savings because it has to offset for you to get to a certain number that balances out over a 10-year period. That's the reason when you really dive into HR 1, some of these things kick in at a certain year, some of them phase out at a certain year. The Trump tax cuts from 2017, which was also passed through reconciliation, that was the reason that they were sunsetting out and they had to be extended because they were passed through a process of reconciliation, which you can only do over a period of 10 years. So it is, I know that doesn't answer your question, but hopefully it contextualizes the answer, right? Because what they did for many of them was not even ideological based on their opposition to SNAP. It's a big pot of money that we can use to offset the cuts that we need to support the tax cuts, right? As bad as that sounds, right? I think in this country, 90% of our budget is spent on just 5 things, right? And they didn't want to touch many of those things. Social Security, Medicare, Medicaid, which Medicaid did get touched, right? Defense spending, right? Like these are things that they just weren't going to touch. Interest on the national debt, they couldn't touch that, right? That's another one of those 5. So it's not so much a question of how do we get them to change their mindset about these policies as it is just how do we get them to support undoing what they did from a numbers perspective, right? That's the barrier for most of, I think, in my experience, most of the Republicans.
Sorry, so you think it's more of like a shifting of an approach to make it more effective?
Absolutely. Okay. I think for many of them, it's a numbers game.
Okay, so would you
Right.
say it's, I'm sorry.
And that's not, please don't confuse what I'm saying is that justifies what they did at all. Like it did not, right? I think, I learned a long time ago, you show me where you spend your time and your money, I'll show you your priorities, right? Well, similarly, show me where you cut your time and your money, I'll show you the things that are far from your priorities, right? And so we can't allow that to be, to go unchecked, right? Taking care of poorer communities was not one of their priorities in HR 1. Taking care of the wealthiest communities in this country was definitely a priority in HR 1. And so how do we shift their priorities? Vote. Shift the people whose priorities you're worried about shifting is a big one. That's the biggest one I say is, and I know people get tired of hearing it, but I say it all the time, like the civil rights movement came with an insurance plan called the right to vote, right, for most people. It did not come with a supplemental insurance plan of what to do if we do not go vote. And to be quite honest with you, a lot of what we're dealing with right now is the product of many people fighting because many people are not voting and trying to compensate the losses in that way. Yes, ma'am.
Going off of that with the voting, would you say then shifting the mindset of the American people, not so much the policymakers? Because I feel like the stigma spreading the stigma into office. So would you say
So I think it's shifting the mindset of the American people about voting. Because I always believe that morality is what people would vote for inherently in the majority. I always feel that. Maybe I'm like, when people go vote, right? 2024, we just had the lowest voter turnout in the state of Alabama since Ronald Reagan was elected, right? Presidential turnout, right? That's not just black turnout, white turnout, that's overall voter turnout. And that's not sustainable when you want change. You got to get younger people to go vote. People under the age of 45 do not go vote. They just don't, black and white. They literally do not go vote nearly at the rates that previous generations has. Okay, Tris. But they just don't, right? So I think it's changing the mindset around like civic participation and civic engagement. Because if we don't, the people who do go vote are the people who are going to be making the decisions. And if you don't go vote, if younger people don't go vote, that means that the majority of people voting are going to be people that are older, that are at different phases of life. And to be quite honest with you, they're worried about preserving and protecting what retirement and sunsetting their life looks like than the issues relevant to a 25 or 27-year-old. So they're going to vote differently, right? Older people inherently vote more conservatively, right? But if they're making up the largest chunk of the voting block, then you're going to end up with people in office like we have in many of these respects. All right, they're telling me to go, so that means I got time for one more question. All right.
Thank you, Congressman. That was a real treat. We don't often get Q&A with the Congressman at events like this, so thank you. Really appreciate it. I'm going to ask the second panel to come up and take their seats. We'll just keep right on rolling. While they do, please grab what's left of the food over there if you haven't already. But we will just keep right on going. And I see 3 out of... At its core, SNAP is the nation's largest anti-hunger program, and it literally makes groceries more affordable and helps keep food on the table for millions of kids and families. But of course, it also does more than that. For children, it improves their health, their academic outcomes, and it improves the stability of their home life so they have a better shot at reaching their full potential. That's what all kids deserve, but it's not what all kids are going to get unless Congress charts a different path. That's because, for the first time in the program's history, states will be required, starting this year, to cover more of the cost of SNAP, and states are not equipped to pick up that tab. It simply means that benefits, which currently are only $6 per person per day, will get even less generous, or people will lose their eligibility, or states will drop out of the SNAP program altogether. In short, kids will go hungry. Congress had an opportunity in the CR moving this week to include the delay that the governors of all 55 states and territories came together to ask for, but they didn't take it. States want to improve program integrity, but they need time to do it, and children want to be able to eat. On both fronts, it's imperative that Congress not miss another opportunity to delay the SNAP state cost shift. We're about to hear why that's so important. I'll start us off by introducing today's panelists, who will say more about their work in just a second. Joining us today, we have Valerie Hanna, who is a kindergarten teacher with the Springdale School District in Springdale, Arkansas. Letitia Buchanan, who is food service staff at Cardinal Valley Elementary School in Lexington, Kentucky. Allison Levitt, who is nutrition director at the Lisbon School Department in Lisbon, Maine. And Michelle Niedermeyer, who is director of the Montgomery County Jobs and Family Services Department in Dayton, Ohio, a state that is very special to me and to Congressman Figures and many other Sherrod Brown alumni in the room. Welcome to all of you. We're very lucky to have you here today to share your expertise and your perspective with us. So let's just get started by having each of you introduce yourselves and telling us a little bit about your work. And Ms. Hanna, we can start with you.
My name is Valerie Hanna. I am an elementary teacher in Arkansas. I am also the daughter of an immigrant and the mother of 2 grown adults, or at least they keep telling me they are. And I have been teaching for 16 years, so I've had a lot of little lives pass through my classroom.
My name's Letitia Buchanan. I'm a food assistant at Cardinal Valley Elementary in Fayette County, Kentucky. I have 3 children. One's here with me today, 2 grandchildren. And I've been with food service for 14 years.
My name's Allison Levitt. I am the school nutrition director for the Lisbon School Department in Maine. I have been in this role for about 12 years now. I am also the president of the Maine School Nutrition Association. And I also have 2 kids, but they are far from grown.
Hi, my name's Michelle Niedermeyer, Director of Montgomery County, Ohio, Job and Family Services, which is our human service agency. I've been in the human services field for almost 23 years, and I have a son who has the audacity to be 28 years old, and a daughter-in-law who I adore very much, and look forward to the discussions today.
Great. Well, thank you all for being here. And thank you, Ms. Hannah. Let me start with you. First, I want to say, sometimes I think I've got a tough job, and then I remember that I sit behind a computer all day, slinging emails, drafting blog posts. I pop in and out of meetings. A lot of them are on Zoom. I am not on my feet managing a classroom of kindergartners all day, so let me recognize the tough and underappreciated job of a kindergarten teacher and say thank you. Yes, that's that. Though I do occasionally speak to members of Congress, so maybe our jobs are more similar than I realize. Yes, thank you. That was a laugh line. Ms. Hannah, if the SNAP state cost shift is allowed to go into effect, it will almost certainly result in kids having less to eat at home. I'm sure you've had hungry kids in your classroom, so can you tell us from your firsthand experience what happens when a child shows up to school hungry?
When I told my superintendent that I was getting this opportunity, he asked me, what's your tagline? And I said, hungry children can't learn. And that is the bare nuts and bolts of it. When I have a student that comes into my room hungry, there is no way that they're going to give any concern to whether or not I want them to learn their letters or their sounds. When they come in hungry, they need my full attention in a way that it's not what I'm there for. Now, am I there for those children every single day to be whatever they need for me? Yes, but what they really need from me is education, and they cannot do that when they're hungry. They come in and they misbehave. They could end up being that kid that nobody wants to talk to because they're always the kid that's pulling their teacher's attention. And they're also, heartbreakingly, that kid that I want to give all my attention to. Taking away a benefit that in my state is already so low. I was looking at, the statistics of it all, and what occurred to me is that I can't believe that I live in the state that has the highest food insecurity. Because I make sure every time my kids come in my classroom that they have a good breakfast. I make sure that when we go to lunch, they're all getting that lunch, and I am on top of them if they're like, well, I didn't like it today. Well, it's what we got, sweet pea, you gotta eat it. And it breaks my heart to know that those funds are going to be taken away from the people who have no control over voting. They have no control over whether or not their mom and dad makes a certain amount of money or not. And they deserve better. Every child in my classroom deserves better, no matter where they came from, no matter what they want to be when they grow up. They deserve better than what this legislation is doing to them.
Yeah. Amen. Thank you. Ms. Buchanan, what do you want to share from your perspective on from the cafeteria?
Just like she said, I do this every day, and I can tell also when kids come in hungry, when they come in late to school, I always try to make sure they come down to the cafeteria to eat. I will go to the office to make sure, because I know it's important, and they can't focus when they don't have the right meal. I know as an adult, if I get hungry, I'm not thinking right. I'm just thinking, I need to eat, or I'm going to be off, so they'll be off too. They can't learn with their belly's hungry.
Yeah. Have you ever seen kids act out in the lunch line, or kids get upset like in the cafeteria because they haven't been able to eat, or?
Yeah, when I first started, I was a server then, and I noticed the child would cry every day. I asked my manager, why does she keep crying every day? And she was crying because her parents didn't have the money in her account, so she knew she was going to get a cheese sandwich. So she would cry every day. So that bothered me, so I got an account of my own. So when she came through, or whoever came through, they couldn't pay, then I would pay for it myself. And then with her doing that, with her focus is not off, it's off in class. So she's sitting there thinking all day long instead of listening to the teacher.
Yeah.
She's focusing on, I got to get this cheese sandwich. And when you do that, all the other students know that you can't afford to pay. So then that brings other situations into play.
Yeah. The story of the cheese sandwich, it has me thinking back to my days in the cafeteria. Is that sort of like the cheapest thing on the menu that she?
Yes.
Yeah, that's horrible. One important consideration in the state cost shift, when you think about the likelihood of millions of kids losing their SNAP eligibility, is that when they lose SNAP, of course, they also lose their automatic eligibility for free school meals. So based on what you see in the school lunch line, why do you think it's so important that they have this seamless eligibility?
Because they can't learn if they're hungry. They just simply can't learn if they're hungry, and they need that. So,
Yep.
And some, they come to school just to eat, not just to eat, but to learn. But it might be the only meal they have all day. And like we were out Monday for Martin Luther King Day. So Tuesday morning, we already knew, prepare more. They take all the food, all the breakfast, all the lunch, and some of it ain't good, but when they take it all, that's a sign that they had nothing over the weekend.
Yeah.
When school's out.
Does it seem like there's a higher demand on like a Monday morning, they come back from the weekend and?
Yeah, Monday morning, and we have breaks, like school breaks, different breaks.
Yeah,
Yep.
that's heartbreaking. Ms. Levitt, I'll go to you next. Maine has actually made tremendous strides in the last few years in terms of child nutrition and school meals. Tell us a little bit about that and why the looming changes under HR 1 actually puts that progress at risk.
Yeah, so a couple things I want to highlight. Maine technically was second to do free meals for all, or universal meals for students in the country, behind California, who beat us by like an hour. So let's just say we were kind of tied, or maybe we won, who knows, I don't know. One thing I want to talk about, and I know we've had a little bit of doom and gloom here today, but something that nobody ever really wants to think about again is the pandemic. And what happened when we went into the pandemic. Certain people were expected to be there and were expected to do their jobs. People were scared. People didn't know what this virus was going to be. But food staff, food nutrition professionals were there making meals to feed kids. Congress came down with the proper waivers so that we could do this for everyone for free. They recognized the need. They did what needed to happen. It gave good momentum. But then once those waivers expired, everybody went back to not offering free meals for all. We were fortunate that lawmakers in Maine recognized the need and put forth on a state level to be able to do that. And the way that it works in the state of Maine is that there are 3 categories. A family would have to fill out a free and reduced form. you're then categorized as paid, reduced, or free. The reduced or free is covered at the federal level, and the paid amount is covered at the state level. SNAP benefits are a huge impact of those free and reduced. That makes up the biggest pot of money so that Maine can continue to offer these meals at no cost. If students are losing their SNAP benefits, the state of Maine is losing that money, and we are in turn going backwards. Many people will probably remember when they were in school that, did you have a ticket when you went through the line? There was often a red ticket or a blue ticket or whatever color it was. That wasn't intentionally stigmatizing students, but it was. It was identifying the kids that were poor and the kids that were not poor. We've done a better job of fixing that system so that there wasn't such a stigma, but there is still that stigma. So when we went to Universal Meals for All 4 years ago, it put every student on the same level playing field. There was no pointing out who was the poor kid, who was the rich kid. We don't pay for their busing. We don't pay for their textbooks. We don't pay for half of their sporting goods. Why are we forcing kids to pay for a meal that they have to be at school for? You have to be there, so why? We went from, I was an active bill collector when I was first hired. I could spend so much time calling parents saying, you know, Timmy has a debt of $150. They don't have that money. They don't have that money to put forth. Since going to Universal Meals, we've been able to purchase a lot more local foods. We've been able to focus on what our jobs are supposed to be, which is feeding kids. And also educating them on what is a nutritious meal, serving them whole fruits, vegetables, whole grains, you name it. I kind of went off the rails, so now I got to go back to where I'm going.
I could ask someone else another question if you want to.
If you want me to shut
If you want to break.
Moving on.
No, only if you want a second to get back on the rails.
No, I'm good.
Okay.
I'll jump back on at the next stop.
Okay, sounds good. Ms. Niedermeyer, I'll go to you next. And you bring such an important perspective to the panel, and that's the local budget angle. Earlier this month, the National Association of Counties, along with the National Governors Association, the American Public Human Services Association, the National Conference of State Legislatures, the National League of Cities, the National Association of County Human Services Administrators, the Council of State Governments, the International City-County Management Association, the U.S. Conference of Mayors. For anyone listening who maybe zoned out while I read that list, it was a really big group representing Republican and Democratic elected officials from every state and ideological stripe in the country. They came together to ask Congress to delay the cost shift. That delay, unfortunately, like I said earlier, is not included in the CR the House is voting on this week. But tell us more about that ask and why the delay is so important that such a huge bipartisan group came together to make it.
Yes, and also I know all of those agencies by their acronyms because we are alphabet soup. So if I start to speak in that, please tell me to stop and I will define these items. Really, we need adequate time to be able to roll out the changes that are within HR 1. They're significant. The guidance rollout was delayed because of the federal government shutdown, so we've been getting things kind of piecemeal. Some things will be retracted and then pushed back out. So effectively, we are currently under guidelines that we don't have fully in place yet. In Ohio, we are one of 10 states where we have state supervised county administered structures for human services program delivery. So we also have that added layer of working with our state, who owns our system called Ohio Benefits, for them to make the necessary changes in the system for us to be able to accommodate all of these changes, which include expanded work requirements, the elimination of exemptions for work requirements, veterans, those experiencing homelessness, former foster youth up to age 26, and it used to be capped at the age of 54, it's now up to 64. All of those individuals will now be required to participate in work requirements, and I am not opposed to work requirements for programming. However, I don't know how effective it's going to be for us to work with someone who's currently experiencing homelessness and requiring them to get 80 hours of some sort of community service on-the-job training each month. So that's my own opinion. I'm not representing the state or even my county, Montgomery County. The impact of just the financial impact of it all. October of 2026, I'm so used to saying that, October of this year is when the administrative cost shift will change. It's currently 50-50, federal, state. It will now change from 25% from the federal government and then 75% to the state. In Ohio, the state pushes a significant portion of that down to the 88 counties. So overall, in calendar year 26, the impact on the state of Ohio will be they have to come up with $70 million to cover this gap. Again, some of that gets pushed down to counties. We have all already submitted our 2026 budget, so there wasn't a lot of flexibility in there to begin with. So we just are really working closely with the state and advocacy groups such as this and trying to really get that messaging across of what this impact means. We in Montgomery County have about 76,000 individuals receiving food assistance, 34,000 are children. So we're at 44% children. When SNAP is impacted in this manner, there's new rules. It's a complex program. I won't steal your thunder on the secondary question with fraud and things of that nature, but we have to communicate with families constantly. You mentioned the pandemic. We saw a spike in all of our services, SNAP, Medicaid, childcare, temporary cash assistance during the pandemic. Even after unwinding, those numbers aren't back to pre-pandemic levels. We have not received additional funding to cover those additional cases. The families we work with then receive less than the level of customer service that we want to deliver. Caseloads are already incredibly high for our caseworkers. We have a turnover rate of 24%. To further emphasize how complicated the SNAP system is, we do 6 months of training all day, every day, and then people will get a lower level of a live caseload, and it takes 6 months to a year before people tell us that they feel remotely comfortable navigating that system. So we work on retention, we do everything we can without the necessary resources. That's a little difficult to do.
Thank you. Ms. Hannah, and I will come back to you on fraud. Ms. Hannah, I'll turn to you. What experience have you had with parents? I'm going back now to the loss of automatic eligibility for free school meals if kids lose SNAP. What experience have you had with parents, and what challenges do you think you might have if kids lose their automatic eligibility?
We have, every year, there's a certain date where we have to get, their free and reduced lunch benefits, or the new the new salaries or the new tax information from parents. And we've almost made it into a game, like which school's gonna get to that number first, because it's all tied into the funding that we receive from the state for free and reduced lunch. And if we don't have those numbers in by a certain time, then we already lose funding. So to take away that automatic, if they have SNAP benefits, that automatic, they are qualified for it from so many kids, that's going to take away not only those SNAP benefits at home, but it's taking away those benefits like free and reduced lunch that we have in the schools. And there's a lot of parents that will say, oh, well, we don't need that. We don't need to sign up for it. We can afford lunch for our kids. And we have to let them know that their statistics and their numbers are what gets us to the benefit. And trying to make somebody understand, like, I know you may not qualify for it, but I still need you because we will lose more funding if I don't have your numbers and your details. That leads, to kids, again, not getting the funding. Ultimately, for me, what it looks like is parents that are, and I mean this in the kindest way possible, but they're too proud to ask for the assistance that they deserve. Because one, it's not just about the parents, it's about those kids. And SNAP benefits are a benefit that every person who pays taxes in our country, and even those that don't, deserve. They deserve to have the right to live, and taking away the money, taking away the funding, taking away funding from kids that walk into my classroom who have experienced things that I haven't had to in my lifetime and I wouldn't ever want to. They're experiencing that idea of, oh, well, I'm not really hungry because my stomach has gotten used to not having food. Making it harder, putting a stigma attached to something like a SNAP benefit trickles down so hard into our students that they stop asking for help. And it's just not okay.
That's heartbreaking. Your students are lucky to have you. Ms. Buchanan, I'll go back to you. You shared earlier that the students in your school call you Miss Tish, and they've been asking where you were today, and I thought that was very sweet.
They've seen me for 2 days.
Yeah, it's very sweet. You've worked in a school that has free meals via the community eligibility provision, which for folks in the room says that if a certain percentage of kids qualify for free school meals, then the entire school does. And you've also worked in one that didn't. So because of HR 1 and other actions taken by the administration, it could be that way fewer schools or no schools at all benefit from CEP. How do you think CEP benefits schools and kids ultimately so that they don't need to pay for school meals?
I think it benefits well, and for me, working, doing it every day, I think all schools should be free, no matter what. If your parents, a doctor, or a lawyer, I don't know if you're still being fed at home. So I think it still needs to be free all around, and like she said, some of the parents are too proud to get help, because I've had several encounters. They'll pack the kids' lunch, but the teacher will notice and come back to the cafeteria, and in that lunch box might be a bag of chips or some gummy bears. That's not a meal. So they have to bring them through the line for them to get a meal. So I would say it just needs to be free all across, so that way nobody's just standing out, or you can pay, you poor, you rich, you can afford it, you cannot. So then that way the kids don't have to worry about that sitting in class all day long.
Yep. Ms. Levitt, did you have more that you wanted to add from last
Do you want me to get
question?
back on the rails? As we were talking, that in the state of Maine, we have made very good strides, and I've had a lot of parents and colleagues say to me, next year are we going to have to pay? Next year are we going to have to pay? And no, it was written into statute. You're not going to have to pay next year. But with this shift of SNAP, it's so uncertain what funding formula is still going to be available that I'm very worried that we're not going to be able to offer free meals anymore. We've made such huge improvements to the quality of the food that we've been able to offer, doing recipe testing, trying to go back to a lot more scratch cooking, you name it. But if the federal money is going away and it's more that the state has to pick up, among other things, if the money's not there, the money's not there. So it's really sad to think about. And when I started this position, meals were not free in Maine. Like I mentioned, I was a bill collector. I was running around getting those free and reduced forms to add up to get our numbers that make Title I possible, all these other different funding formulas. Can your student get a laptop at a reduced rate because they qualify for SNAP? I mean, there's so many things that are tied into it that thinking about going back to that, it makes me, honestly, I love my job. I'm here because I love my job. I'll shout it from the rooftops, but it makes me want to go into a different career because I did not sign on to give cheese sandwiches and do all these awful things when it should just be a basic right for all of these students. And families, like, one less thing to worry about. I mean, let's be honest, kids in school these days, we have social media, we have all these crazy things. Like, let's just take that off the table, feed them breakfast and lunch, and it shouldn't be a big deal. But why? I don't know. So with everything going on with SNAP, I am very concerned about the integrity of programs like mine and those that are trying to get to universal meals.
Thank you. Another question for you, Ms. Niedermeyer. There's so much emphasis on quote-unquote fraud in HR 1, and a lot of the narrative and justification for these dramatic policy changes has been to reduce so-called fraud. In fact, the chair of the House Agriculture Committee was asked about it just this week, and he said, we're doing it, because there's just so much fraud. But fraud, of course, is not the same as errors. And that's actually what local governments like yours are charged with reducing. So could you explain the difference and share with us how additional efforts to reduce errors actually put children and families at risk of losing benefits?
Absolutely. The financial piece of that is part 2 of the cost shift that's happening with SNAP. So that would be benefits. Right now, all SNAP benefits that are dispersed to families and individuals across the country are 100% funded by the federal government. Starting in October of 2027, it will be based off of each state's individual error rate. Ohio is close to 7%, so that would mean Ohio would have to pick up $160 million to pay 5% of that allotment. If we would go up by 1/100th of a percentage point in that error rate, it would double to 320 million. Sorry, millions and billions all over my page. So obviously, with the administrative cost shift and then the benefit cost shift, programmatically, our budgets do not have the cushion to be able to pick these up, especially so quickly, which was why they asked by the multitude of organizations that was mentioned at the beginning. We're going to continue to work to see what we can do. In the meantime, as a state in Ohio, we are doing everything we can to try to reduce the error rate. Now, the distinction between error and fraud is intentionality. As I mentioned before, SNAP is a really complex system, both for the families we serve and for our caseworkers. If someone moves, because we know that stable housing is a challenge for our families these days, they need to report that to us. Well, we might not be the first person they reach out to. They are getting utilities turned on, notifying schools, just getting settled in. So if we find out after their benefits have already been loaded, that is in fact an error. Also, if we somehow calculate and award too little to a family, that too is an error. So it's not that it's all focused on the benefits going out. Like if we under issue $20 and over issue 20, it doesn't balance out. So again, the complexity, they have to report medical needs and expenses. We have a standard utility allowance, so all your utilities, you have to bring in bills. I know personally finding all the utilities with my name on it as a renter, sometimes a challenge. Childcare expenses, if you receive child support or if you're cooperating with child support, there are so many moving parts for our families who are struggling so hard to achieve self-sufficiency. We want to do our best to help them with that, but again, as I mentioned, with this caseload, and these additional challenges that are coming our way to try to maintain integrity of a program that already unofficially has an error rate for fraud of less than 2%, it feels like, I'll say, and again, my own opinion, overkill. I think that there's much more effective ways that we could handle this. There are system changes that do need to be made. We want to be good stewards of taxpayer dollars, absolutely. We don't want anyone to receive any of these benefits fraudulently. What we do see with fraud versus error is on the retailer side. We see the larger scale things. I'm sure many of you have heard about the skimming of EBT cards. There is a question, I haven't received a final answer yet, if skimming is going to count against a state as an error, although we have no control over that. I too feel like I'm going off script because there's
a lot to
so
talk about.
much, so much, yes.
Well, as the moderator, let me encourage off scripts.
So I'm an appointed official, so I'm trying my darndest to behave. Really just looking at if the end desired goal is an efficient program and people receive it because they need it, that is what we are doing. We are working closely with families. We try to communicate proactively. The federal government shutdown was at a key point when they were rolling out these changes. We are now being held to standards retroactively that we didn't have those rules or regulations at the time that they were effective. We'll get something, we'll make significant changes to workflows and systems, and then we're gonna switch that. And this is a big ship. We can't turn it on a dime like that. We are used to pivoting and flowing with changes, but these changes have been so significant and so rapid fire that we're just trying our best to continue to serve the families in the best way possible, deliver excellent customer service, help them stabilize, and help the kiddos get everything they need to be successful in school.
Yeah, I did want to underscore something that Congresswoman Craig said in her remarks, which is the point she made about the shutdown and the confusing and contradictory guidance that USDA issued to states and counties during the shutdown, which was pretty chaotic.
If I could add.
Sure.
For my statistical nerds like myself in the room, Ohio has 1.4 million people receiving SNAP. Our error rate is determined off of a case pool of 1,020 cases. I don't believe that's a statistically representative sampling of what our error rate would be. So we are truly at the luck of the draw of those 1,020 cases. It's just not reflective of the hard work that I know that teams all across the country are doing.
And is there anything you want to add to the point that Congresswoman made about the contradictory, chaotic guidance during the shutdown?
Well, that wasn't a setup, was it? Absolutely no chaos. Everything's perfect. I mean, honestly, I've had an alert on my phone for executive orders for my 23 plus years, and I've never had my phone just constantly ping the way it has over the past year now. And again, we try to be proactive. As soon as we hear it, okay, let's sit down, let's make the modifications, and then things will change again. And I can't emphasize enough, the team that I work with is phenomenal, and they are in it, and they are trying to do what is right for the families. But I see their struggle. We have brought counselors in because I am seeing the burnout and the effects of people dealing with families in crisis. We admittedly work on SNAP first. Again, these caseworkers handle Medicaid, child care, cash assistance. We also have adult protective, child protective services, child support, the whole gamut. We put SNAP at the top of the list because we can't retroactively feed people. So SNAP has always been our focus. The error rate has always been a focus, even when there wasn't a monetary penalty tied to it. So I just really would love for people who are pushing out the guidance, come to Montgomery County, Ohio, take a look at how we process these cases. And if you see a flaw, let's absolutely discuss it. But we have extended that invitation, and some people may take us up on that, but I really want them to see what it looks like on the ground.
Well, as Washingtonian who has taken the direct flight on American Airlines out and back to Dayton several times, it is possible, and I concur. I recommend. I'll put this question out there as a jump ball to the panel for anyone who wants to share. We know that families turn to food banks during times of need. And from your perspective, if there's are major changes in SNAP eligibility, if kids and families lose it, what do you think? Will food banks be able to fill the gap? Will they be able to meet the need?
Our local, I'm sorry.
Go ahead.
Well, this is my fault. I said it's a jump ball. So
Everybody, what we experienced during the shutdown was my school counselors talking about the amount of parents, like they might have one or two, and this is just at a singular school within my district. They might have one or two requests during a certain time period. During that time period, I think they were at like 14. So, we're not talking about doubling or even, it's an exponential amount of people that need it. I also, fun fact about Arkansas, it does have a certain corporation that is the largest in, the world, and yet we have kids going hungry in our backyard. We saw a dramatic amount of kids asking if they could take things home because they weren't sure if they would have it. So, the fruits and vegetables that they get at lunch that they're not prepackaged, but everything has to, and this may be an Arkansas thing, but they have to have packaging around them. They would ask, oh, well, can I take this home because I can put it in my backpack? It was something that was already essentially bagged. That went up, and that was just in a short moment of we didn't know when it was going to come back, but it was still okay because they'll be back as soon as the shutdown's over. But it hasn't been.
I'm gonna go off script a little.
yeah, please do.
During school, when the school break, like summer break, that has an impact too, that they don't get to eat. So where I work, I live like 15 minutes away from where I work. So I tend to, on my time, go through the neighborhood because the kids know me. And most of the time they're at a park. So I'll go look, holler at them, and I go to Little Caesars, about 6, 7 pieces, whatever, drinks, and I sit it there, and, oh, Miss Tish, thank you, thank you, thank you. And then they, this year past, they moved, everybody was getting free lunch at the schools, so they moved it to like certain schools. So if they can't get to the school, how can they get a free lunch if their parents don't have transportation or anything like that? And she was talking about the kids asking to take the vegetables home. I had an encounter. I noticed a little boy, he was like stealing extra, the line's here. So, like, okay. So the manager's like, no, you shouldn't steal. He was getting on them. So I'm like, he kept doing it. Then I pulled my manager aside, no, something's not right. The child's stealing, and they keep doing it. There's a reason. So I pulled the child to the side, not in front of everybody, and asked him what was going on. Well, he was taking the food because he had little siblings at home, and he wanted to make sure that they got a meal. So I assured him, you don't have to do that. So I went to the front office, and I told my manager whether I'm going to get in trouble or not. Some of this food we throwing away, we need to pack this up and take it to the front office and take it home. Let him take it home, and don't do it in front of the class where they know he just don't embarrass him. So from that day on, he stopped.
Yep.
He stopped doing it. So it's really needed at the schools.
Yeah.
Yep. I see it every day, all day long.
I mean, wonderful that you were able to do that, but it shouldn't take inventive workarounds from the cafeteria staff to be able to feed children. And your point about the summer, I mean, just underscores all the more reason why we need free summer meals as well.
They offer it, but if you don't offer it at their school close to their home, they don't have transportation to get it, then how they gonna get it?
Yep, exactly. Either of you, Ms. Levitt or Ms. Niedermeyer, care to weigh in on the food bank question or any?
I would just love to give a shout out to the food bank in Dayton. I have them on speed dial and vice versa. As soon as we started hearing the rumblings about this, we pulled together. They were assessing increasing their days. They have special days for seniors, weekend hours. They have volunteers there, so they were like, we just need to get everything in order. And also a shout out to my Board of County Commissioners because they have given them $1.5 million to help support their efforts in this because my commissioners recognize there's going to be a gap that's going to have to be filled, and it's going to have to be filled grassroots food banks. We've had a lot of churches or other community organizations kind of pop up. The food bank, because they can get so much bang for their buck, they then distribute to, I think it's just over 100 other agencies right now. So we funnel money, that sounded illegal. We give money to our food bank.
Prioritize.
We prioritize funding going to the food bank because we know that they're able to really leverage that. And then they disperse to these other entities because transportation can be a challenge. So again, just working closely with them, they've been amazing. I know that there isn't a food bank in every county. So I know that sounds strange saying a food bank's a luxury, but I know that that's something that we are really grateful to have in our backyard.
I know that when some federal funding was taken away for farmers, obviously that affected farmers, but a lot of the food that they were growing was going to food banks. So it's been a kind of a trifold, can the food banks pick it up? Not necessarily, especially when something that they were relying on regularly was then taken away. So
Yeah.
It's a very circular problem.
So I'll open it up to the room in just a second for questions, but before I do, let me just ask our panelists here if they want to share any final thoughts. Anything you haven't said already that I didn't prompt you with a question that you want to share?
I have something there.
Okay, yeah, please do.
Something.
Yeah.
If we are serious about education, we must be serious about nutrition. Because when we nourish our children, we are not just feeding them, we are fueling our future. And our heroes don't wear capes, they wear aprons.
I love Perfect. Amen. Panel over. But if there are questions, happy to take some. Yes.
Sometimes when I talk to offices on the Hill about the issue of families needing to fill out the applications if drug certification goes away, like you made a good point, like that families, there may be pot, there may be, but like their attitude is like these parents, the least they can do is fill out a piece of paper so they can get money for their children to eat, and so I just always trying to refine the way I would answer that question or that statement that they might make about filling out forms. So if you have any other suggestions on speaking to that issue about filling out an application for free or reduced price meals, or the importance of keeping direct certification in place.
Are you talking about speaking to people on the Hill or to families directly?
No, to people, policymakers.
Oh, like people on the Hill say, like, well, geez, how hard can it be? Like, it's just a form.
I mean, I guess I would say to them, do you want to write down how much money you make, put it on a form that's going to go in Timmy's backpack, that to Timmy's teacher, to Timmy's secretary, and then to the nutrition director that's supposed to be private? A lot of us work in small towns. I know Timmy's mom and dad. Now I know how much money Timmy's parents are making, you know? It's a very private thing that should not be the catalyst of getting a meal or getting a laptop or getting funding for necessary teachers. It's a very old school way, and, you know, that information can be derived from income tax, you know, all of that information. The information's out there. It's just a matter of finding the right way to capture it.
I would also say that they're acting like the form is just easy peasy, as I would say to
And
my
it's-
kindergartners,
yeah, it's
easy
very
peasy lemon
very
squeezy.
confusing.
And the truth of the matter is that, you know, they may not know, they may not have gotten their tax forms back from their employers, or they have 6 of them because they've been through 16 different jobs over the last year. So trying to, you know, put that information together, and do you need, you know, one parent or the other to fill it out, or is it, if it's you know, a family who's got parents who aren't married, does it have to be both parents? There's so much information that goes into it, and, you know, I'm right down here at the end of my panel where, you know, she's telling us how she's being given directives that are changing probably daily, and quite frankly, that's the way education works too. And those forms are not easy. And especially, you know, for students whose parents, who maybe English isn't their first language, that becomes a difficulty for them to have to come through. And you know, or if they have to ask for help, if I have to go to the secretary, and now she knows my business too, because I need the secretary to help me fill out this form that I don't understand in the first place, and now the secretary knows my business, well, maybe the secretary can't figure it out either. And she has to ask either, you know, our cafeteria staff, our nutritionist, she has to ask the social worker. There's so many things that, you know, give people the anxiety of, like, you know, how many times have we paid a bill longer than we should, or not canceled that gym membership because we don't want to call and talk to a person we don't even know to say, please don't charge me this anymore. You know, we all do that, and I can't imagine that anyone, you know, any of our representatives feel any different. They don't want to make that phone call either. They don't want to have to fill out their paperwork. That's probably why they pay their accountants or they pay their tax people to do it for them. And we're talking about families, they don't have the luxury to have somebody to do that for them. And trying to figure it out for themselves is not easy. So I guess asking them to be patient and think that there are things that are difficult for everyone to do, and not expect the most of the people who, quite frankly, need the most.
Can I also just quickly reiterate on that it's not just getting the form back. Like you said, it is confusing, but when I would get the forms, I would go through and process a bunch of them, and then I would have a pile on the side of all the people that I needed to call back. And a lot of the times, it would be somebody would fill it out and they would write $50,000 weekly. And I'm like, do they really earn $50,000 a week? So then I have to call them and, like, tell me that's not an embarrassing call, you know? So it's tough.
All right, Tim, last question.
On that same note, can you give another example about how, if direct streamline goes away, how much additional time is that going to put on you and your school food service folks that we can utilize as advocates to talk to Hill staffers? Because often enough, they do not understand how the direct cert, CEP schools, et cetera, save time. I mean, I know this.
I could cry thinking about it, to be honest with you, because that's not what I signed up for. You know, I came from restaurants and hotels and all that, and oh yeah, I want to work in a school, same hours as my kids, this is great, providing them wonderful food. With the direct cert list and receiving the forms, it's a lot. And when you say me and my staff, me. It is me. I don't have an assistant. I don't have my managers in the cafeteria filling out forms. That would literally take up the bulk of my job, and then we're going back to serving just hot dogs and beans every day because I don't have the mental capacity to come up with some new recipes and source them and all of that stuff. So I mean, the amount of time is asinine, and not only that, but they change the form every year. Every year! Once somebody gets used to what it is and what it's supposed to be, here's a new one. So, happy to go talk with you if you need me to.
Do you want to tell about the project that the grant project you're working on instead because of?
Yeah, so I'm very lucky to be in a grant project through Full Plates, Full Potential, which gave money to several projects in Maine, but I'm partnering with 2 other districts that we are creating a food hub essentially and bringing in more local foods into our schools for our kids. So every week, every month, we're doing, different taste tests. Tomorrow, when I'm getting back in at 1 a.m., and tomorrow we're doing a fish tot sampling of a local fish item. So I've been able to put my energy towards doing awesome things like that and exposing kids because, like you said, food is education. Teaching our kids at this young age what they're supposed to put in their bodies. There are no nutrition classes right now. Well, I can't say there are none. There are minimal nutrition classes. A lot of schools don't have home ec anymore. They're not teaching you how to cook. They're not teaching you how to do your finances. So that's kind of an added thing that we take on is, I'm going to expose you to roasted broccoli and steamed broccoli and raw broccoli because you might come to me and say you hate broccoli, but roasted broccoli I like. So we're able to focus on things like that instead of doing these ridiculous paperwork loopholes and calling families. And I was actually told at one point to take the form at face value. So if I get a form back that is signed with nothing on it, then I assume this family has 0 source of income. They get no Social Security, they don't have a job, they don't have anything. And I process them the way that it is. I mean, the whole system is not my favorite.
All right, Ms. Tisch, do you want to hit us with your line one more time, and then we'll close the panel?
Our heroes don't wear capes, they wear aprons.
All right, there we go, all right. I want to thank my panelists for joining us today. This was a great panel. I'm very fortunate to be joined by the 4 of you, so thank you for being here. And thank you, everyone, for attending this event. This is it. Thanks.
Thank you.